Right.
So when we talk about, treatment considerations for autism, what I always do, what I train my students on is that you have to kind of pull things apart. You can't look at this as a smorgasbord. You
Right.
can't say, oh my God, there's a million things going on. You pull them apart and you address it, but you address them separately, but together. Meaning, here's what I mean. If they have toileting issues, you deal with toileting issues at the same time that you're dealing with social communication. So SCAT being a social communication anxiety, CBT based treatment program, we still use the same concepts, right? So when we're formatting school-based accommodations, although friendships are difficult, and they are for kids on the spectrum, we will still try to implement a buddy process which is more teacher facilitated, having either a one-on-one aid, not always because funding's difficult, but having set times to interact with peers, because if you wait for the child to do it, it's not going to happen. We implement the small groups. We implement the small groups out of the room. We implement activities that the child can do, but with help. And so when speech is difficult, I find the kids can play these games and get immediate rewards rather than if I work and I have 10 stickers, then I'm going to get that, or 10 tokens, and then I'm going to get that, which will lead to this, which will lead to that. It's got to be more automatic. So they'll work on their interviews, and many of them don't even need rewards. They'll just do it when you set it up.
Right.
So a treatment consideration is, I find, more parent and teacher involvement more than ever with kids on the spectrum, because they need to facilitate those changes. And unless those parents and teachers are working with somebody that has an expertise, you're going to get all confused because you still need to understand their baseline. Are they completely mute in school? Is it because, how many times have you seen a patient that comes to you that is mute in school, mute with aunts and uncles, but you sit them down and within 5 minutes they're answering, like you said, either choice questions or time to reflect, warm up time in a quieter environment, like you adapt it and you intuitively from your experience know, and the child becomes verbal. And then not only are they verbal, but you get them to be initiative because they can write and read or just read. And then they begin reading questions to you. So you go out in the waiting room, or not in the waiting room, but in your office, you meet with the parents and they're like, he was pretty shut down, right? And you're like, well, in the beginning, yeah, he was, but with some warm up and of course, focusing on his interests, he was able to respond. And he actually asked me questions, and they look at me and they go, there's no way that's true. And I'm like, well, let me tell you how that happened.
Right.
And
That's
then I
right.
explained it,
The
bring
skill.
the child in, and they do it.
Right.
And it's like, how did you know? And it's like, part of how we know is the years of experience and intuition. What can I tell you, right?
Yes. Yeah, I think that that's a very good example that you're using. And we don't, I tell parents that the treatment for SM in general, there is no secret. And if somebody tells you there's a secret, like play therapy forever, then this is not the right thing to do, because we, with experience and with also some evidence from research, we know that there are certain skills that we can use and certain ways of interacting with the child that may facilitate. And that's why I like to be in the background. I like to be training parents and teachers on how to use the language that they do in order to obtain and to create a more comfortable social experience for the child, that they will decrease a little bit of the anxiety of the child. I think it's a very important point that you made. And in terms of treatment, I really like what you said about autism plus SM and SM alone. We need to know what's impairing the most. And sometimes, really, I've had cases of level 2 or 3 autism with SM, where I really needed to treat the ASD symptoms that were self destructive or they were aggressive towards teachers and to other people in the classroom before we could address the SM, because the child couldn't receive a compliment, or because the teacher couldn't be that close, or if somebody took the child's pencil. So there was a lot of difficulty with territory and also with interaction with the teacher that we needed to take care before we treated the SM. And we need a multidisciplinary team for that. And when we have a speech and language disorder, we really need to have a speech and language therapist that is trained or is guided by somebody who is an expert in a selective mutism.
Oh yeah, those are excellent points, and that's why working with Dr. Evelyn Klein and developing that study of how to
Yes.
assess mute children, and we do this also at the Smart Center. We have to offer assessments because these kids need to be assessed, and they many times, as you said, schools don't know how to assess them for IEPs, and a lot of private professionals don't know how to deal with SM and be able to even differentiate that. One of the things to consider also in treatment is adapting the strategies and the interventions to their developmental age. I had a 16-year-old that had SM and autism, 16, right?
Hmm.
So they were functioning though at like a 6 or 7-year-old level.
Wow.
Therefore, we needed to adapt the goals, and as I call for younger children, the games for a 6 or 7-year-old. Giving them unrealistic goals for a 16-year-old, which is what I see, amazes me sometimes. It won't work for that child. So when he did interviews and he could speak, his speech was obviously delayed, and he obviously had difficulties in different areas of his speech and language, but he could speak, and he had the reading level of a 6 or 7-year-old. So when he met with his aunts and uncles or even with his teachers, we did some interview or what's your favorite for Thomas the Train.
Right.
So he was able to not only ask questions because he had the pictures. So who is your favorite? Who is this? And it was like Thomas or Freddie or whomever. I don't know. I can't even remember half the names. And he did it. So the point is, it's the practice at the level that they can be at to reach their capacity. It wasn't about him being mute. He could speak, but it was at his capacity of speech. So what I tell families and what I tell schools, and I'm sure again you do this too, is that we can't cure autism. We can't cure it. We can help them reach their capacity. And I learned that when we were doing research on SM from Dr. Sharon Armstrong, because as a physician, I am taught to cure. I
Right.
am taught to cure. That's how I'm taught from the minute I enter med school, curing. And it's hard because when you're in a field like this, yes, I believe you can cure SM. I'm going to put it out there. You can completely overcome it if you have the capacity to be a confident social communicator of a typical, doesn't have the innate speech and language or even develop those skills. You can overcome this. But with autism, there's going to be autism features all along. It's how do you accommodate them and how do you provide those interventions to help them reach their capacity. Do you agree with that? Do
I,
you see that too?
but I'm going to tell you that I just had a meeting with child neurologists on this topic too. And the new research that Ami Kim has been doing for many years, using the machines to see eye contact with the little babies, they are now able to observe under 9 months old if babies are showing signs of features of autism through that very specific tool, and they are stimulating children. I'm not saying that it cures, but because we don't know yet, but there is hope on if babies are seen very, very, very young, which is the future, is not here yet. Those machines are not available commercially yet. They are at the university still, but there are ways that they are treating autism if it's really early in life. But we are talking about children who come to us already. Usually children are diagnosed with SM about 2 years after they show symptoms, and that's why I always say the earlier the better. And they come at maybe 4 or 5 when they are in preschool or kindergarten, and they already had symptoms at the age of 2 when we could notice that they were developing language and didn't speak in certain places with some people, but yes, with others, going backwards. But that was the critical time to treat ASD, before 2. And that's why it's really important to screen early. So parents who have a child with ASD or who with SM, it's really important to screen for ASD, but also other siblings too. early as possible.
That's, yeah, that's great information. That's wonderful. Thank you for sharing that.